Let's do some other stories now. The Ghana Psychological Association says it will offer free psychological and social services to children of a couple who died under strange circumstances at Ichima Makro near Abuakwa in the Ashanti region. The Ghana Psychological Association said it was touched by the plight of the children after monitoring the story on JoyNews. The bodies of Mr. and Mrs. Jackson, suspected to have died several weeks in their two-bedroom apartment, were retrieved by the Abuakwa police after they broke into their locked apartment. The police also rescued their two children, 11 and 13-year-old, who were found in an unconscious state. We'll hear from the GPA shortly, but first my colleague Ohemin Teria joins me via phone with an update on the story. Ohemin, the children were admitted at the hospital to be resuscitated. How are they faring? Well, Ohemin, if you can hear me, bring us up to speed on how the children are doing. They were admitted at the hospital, but we do not know what has become of their health as we speak. Well, let's go into Zoom now. We'll get Ohemin back on the line. Let's go into Zoom and speak to Dr. Collins, who is the president of the Psychological Association, and he joins us. Thank you very much, Dr. Collins Ajiman. So you indeed want to support. How exactly, what form is your intervention coming?
Right. Thank you, my brother. So basically, when we heard this particular story aired by Ohemin Terry on behalf of the multimedia group, we were very much touched. And so the first thing we did was to get in touch with multimedia group, get to understand the holistic aspects of the story. And then we got in touch with the medical team in Kumasi, the superintendent in charge, and the team managing the biological and physical aspect of these two children. And we took some briefing from them. As at yesterday, we had to put a team of professionals together. We have put a team of up to about 8 for now to be able to do the initial assessment and scoping. And yesterday that was done. Now, the nature of support we need to give. I must say, when people go through traumatic experiences, such as what has been reported, if we don't manage it well, it can linger, it can take a long time, and the devastating effect could be very dire, not just for the people involved, but even relevant others. So for now, our primary target is to help these two children and manage them. It could take several weeks and even several months, if not years, trying to support these children. The next target has to do with tenants who may have occupied the same space with these persons involved. Then we will have to also concentrate on neighbors who may have trooped in, who were aware, got to the scene, saw some of the pictures, got to hear first-hand information on these things. Then family members, as I yesterday, some family members have come in. We need to also support these family members. They've lost loved ones. However painful the story may be, they will also be affected in one way or the other. And then first-hand responders, especially if you look at the police and if fire service were also there, we need to also support them. Usually, they are always first to be at a scene. They are also humans. We call them Merimama Yuki, that they are the men who support us, but they are also humans. Experience has shown that as they respond to some of these crises, sometimes they also go through depressive episodes and will also need help. One last thing that I need to mention, we are particularly interested in how we will co-respond with the police. We want to support the police so that their line of questioning, what kind of questions they are going to ask, how they will ask those questions. Will it be the right time to ask those questions? We would have to guide the police as they do their investigation so they don't end up also re-traumatizing the children as they try to get to understand fully what really may have happened leading to this unfortunate situation.
That's an elaborate plan there, but by way of your assessment, what can you tell us about the health of the children? Are they in the position to begin these processes that you talk about?
Well, currently, like I said, we are working holistically. And so from the medical team, they have started responding. And as we heard from the superintendent in charge, they had lost a lot of water, so they were very much dehydrated. So we are hoping between yesterday and today, as they have continued to support them, they will begin to respond actively. And so, depending on the green lights from our colleagues, we will also begin to do our work. And I must say, even if someone is not speaking, we render support to those who are not able to speak, in terms of those who are not able to utter words as we are doing. So our experts will be able to also use those skills that they have acquired over the years to still begin to support these children that we are really yearning to give them the best of care so that they will be able to come back and live their normal lives in the course of the time.
Doctor, I'm grateful for your time. That's Dr. Collins Ajiman, Bedu Ajiman, who is the president of the Ghana Psychological Association. This is News Desk with me, Anna Smith. We are business after this break.